Medical professionals of Reddit, what's the most obvious case of faking it you've witnessed? A surprising number of people try to fake being unconscious, but there's a simple test for that. Pick up their hand and drop it onto their face. If they smack their own face, they're unconscious. If they move their hand to the side as it drops, they're conscious. My mom had a patient who said she had past kidney stones at home and needed painkillers. The lady actually brought in the kidney stones as proof. Patients don't usually do this, and the stones were way bigger than people can pass on their own. My mom sent them to the lab and they came back as geological origin. Aka. Crazy lady picked up small stones from outside to try and get meds. We have a patient at our primary care clinic who claims to be blind. He always comes in with sunglasses and a white cane. We were always suspicious though. Something definitely seemed off. One day someone followed him out of the building. He walked through our nearly empty parking lot and down the street a little ways to a car parked out of view of the clinic. He folded up his cane, got into the driver's seat, merged into traffic and drove away. I had a woman come into Tridge in labor and delivery. We ruled her out for breaking her water. She was pissed that she wasn't going to get induced and be delivered. So after I left the room she flooded the bed, the floor and herself with tap water. Literally gallons and gallons of water. It was leaking out from under the door. So much water, it was like that scene in Comheads. She said it was her water breaking. Again quickly ruled her out and told her she needed to go home. She subsequently peed the bed before leaving. Called to a bar for a seizure. Waitress says she delivered his bill and he suddenly went to the floor having a seizure. Look over at him. And he's laying there flopping his arms and legs around. As he looks his right in the eye and screams over and over, "I'm having a seizure." We tell him to stand up so we can take him to the ambulance. He doesn't, starts walking to the door. We tell him to hold up. Go to pay your bill first. Man, was he pissed at us. Waitress tells us he does this all the time. Well, not today. He still took a ride to the hospital though. The hospital has good egg salad sandwiches. My grandma used to work with a lady at a hospital, funny enough, that would always say she got an on-the-job injury and needed to take a few weeks workman's comp. A doctor there would somehow always give her a note and she would get a free week or two vacation, come back for a month, and do it again, obviously milking the system. One day her boss said, "Okay, but there's nothing for you to do here on light duty. Usually we'd send you home until you're better, but we're going to have you come in until you're better. But there's nothing for me to do," she said. He told her, "I know. Bring a magazine or something. It'll be a long day sitting in the break room." She lasted 2 days and never pulled that stunt again. My mom had a frequent flyer at the emergency room she worked at. This lady was constantly in unimaginable pain over everything. She got a splinter in her finger and that constituted a 10 on the pain scale and she needed painkillers to deal with it. She was a known drug abuser as well. She had been caught stealing needles and shoving them up under her huge sweaty boobs. The only reason my mom found out was because she came back in to place the EKG pads, and to do so, she had to lift her boob up to place the pad. When she did, the needles rolled out. From that point on, they had to have a member of security watching her anytime a nurse or doctor left the room. She also had a massive arrest record and there were times the cops would bring her to the ER instead of an ambulance. When they told me they were allergic to Tylenol, acetaminophen, but Vicodin works really well for them. Not quite the same thing, but in the ER, a woman came claiming she was in labor, so got her on her way to land. Land sent her back saying she was faking it and needed to go to the psych ward. Quick physical exam showed that was false because the baby was crowning. Sent her back to land and from what we heard, baby was delivered in the hall on the way there. Not a medical professional but work security in an ER. Once had a guy come in, announce that he was going to have a seizure, then laid down slowly and comfortably in the floor and didn't start seizing until he was sure everyone was looking at him. Then when the nurse, who knew he was obviously faking, said they were going to have to run a tube down his throat, he was suddenly fine. When I was a labor nurse, the emergency room sent up a gal who said she was in labor. She was a sturdier lady so it was hard to tell. No prenatal care. No fetal heart tones. Did an ultrasound. She'd had a hysterectomy. She and her partner insisted we were wrong because they prayed and knew they were having their miracle baby. Good luck with that, mom. This person had a long mental health history. I have no doubt that she believed she was pregnant. Lady kept putting cut up plastic pieces up her uterus. You read that right. Not in the V. The uterus. Wanted to be perceived as a medical mystery. Surgery to remove it. Complains of more plastic coming out hours later. Doc says I took pictures. There is no more plastic. Tells her to stop doing it. She requests a new doctor, and another surgery occurs. More plastic. This is called Munchausen factitious disorder. Incredibly frustrating to deal with as a provider. We had a patient come in on a workers' comp case with severe injuries to the chest. He states that while working in a grocery store parking lot, a female deer spots him from a distance and decides she wants him. Once she gets close to him, she kicks him in the chest several times and then headbutts his kneecaps in. Once he's on the ground, she stomps on his chest and head. He wakes up several hours later and immediately comes to us. Not only was his story completely ridiculous, but he didn't have a single mark on his body. No bruising. No swelling. No broken bones. Just nothing. He rated the pain at a 10/10 without a single scratch on his body. Needless to say, he got his claim denied. Not exactly faking it, but funny story. When I was working in the hospital, a patient's screen with his vital parameters started showing dangerously low levels of oxygen in blood, which basically means somebody is suffocating in a way. So all alarms go on and the nurses and one doctor rush to the patient's room while the CPR mode is active. Surprisingly, the patient was looking all well and didn't show any blue skin, sign of deoxygenate blood. He was even smiling. So everybody just confusedly went on with their business. Except for this one sister that grinned at the old man raising her finger, saying, "OMR Smith, did you hold your breath again to see how fast the oxygen levels drop?" And he just started grinning like a 5-year-old and nodded. One of the funniest moments. D. My favorite trick when I suspect a patient had a fake seizure is, I ask them to show me what the seizure looked like. If they start demonstrating, they're full of it. Real seizures won't be recalled as you're unconscious during. Had someone fake seizures, would be talking normally. Stop, shake briefly, stop and then peek at me to see if I was watching. I believed it initially until I called the MD and they came in while the patient had another seizure. Doctor picked their arm up over their head and instead of the arm falling on their face, it changed course to avoid slamming into their nose. Not a medical professional. I was thought to have been making my symptoms up. That it was all in my head. 2 years and a mess load of doctors later. Turns out I have a muscle disease. So apparently I'm really bad at having a disease. I know even the doctor that found it thought I was faking it. He apologized profusely and sent me to a specialist that deals with rare muscle diseases. I commonly have young kids who really want glasses because some of their friends have them. They'll come in acting like they can barely see the biggie on the chart. I change some lenses in front of their eyes. Give them a little encouragement that they can see better. And they can magically read 20/20 with little to no prescription. They're not big fans when I tell them they don't really need glasses. Had a PT come in with uncontrolled diabetes. He was type 1. His BSL was really high. A couple days and it was back under control and he was ready to be discharged when they went out of control again. Those pattern continued. About 7 AM one morning his girlfriend fronts me needing a note for the judge. He was supposed to be in court at 8 AM. He'd been eating wild amounts of food to try to get out of going to court. Then wanted us to fix the situation with 1 hour notice. We did nothing. He went home about 11 AM. Pediatrician here, so my patient was younger, and I think influenced by mom. This 13-year-old kept getting admitted for complaints that never made sense. Lack of smell, dizziness, seizures that would happen while he was walking, running, heart felt hot, etc. Every specialist under the sun had seen him and cleared him. He had every test and imaging study you could think of. There was a lot of social stuff going on and this was a hard family to discharge. He'd get admitted. We'd run 100 tests and as soon as we were about to discharge him, some new symptom would come up. The worst was once after I had already written the discharge orders and the nurses called to let me know the patient had gone blind. I was grouchy that day and wasn't having it. I went in with a rolled up piece of paper. I checked his pupils. I used a Snellen. I went through the whole rigmarole. Then when I was talking to his mother, without looking I threw the paper at him hard and fast. He yelped and dodged it. I told mom that they were going home. To be honest, I still feel a little guilty about it and don't know what the right thing to do was. I worked as a nurse on a cardiac floor. Chest pain was the biggest thing people would use to drug seek. Because if nitro isn't working, we also give oxygen and morphine while turning it into an emergent situation. We even have an acronym for it. Bona, morphine, oxygen, nitroglycerine, aspirin. All are interventions for a heart attack. When you have a heart attack, your cardiac tissue releases these markers. Kind of a distress signal. We can pick these up on a blood test. Sometimes a heart attack can be seen on an EKG. If a patient had a history of negative tests and or multiple admissions and all their vitals were normal and I expected they were faking it, I would ask them if it hurt when I put my hand on their chest. They would always say yes. And then I could happily inform them that this likely wasn't cardiac but muscular pain, since heart attacks won't cause pain when your chest is touched. I would suggest a warm compress and some Tylenol, and their pain was always mysteriously gone within seconds of my announcing that it couldn't possibly be related to your heart. Neosus copyright airing. After a while you do get very used to the signs and symptoms of people actually having a heart attack. There's just no faking that level of panic or the look on their face. Had a patient arrive to my unit thrashing around on the stretcher and saying, "I'm having a seizure. I'm having a seizure." Transport, and I moved her into her room and I told her to call me when she's done. Amazingly, she was cured. Not a medical professional but also so when I was visiting a small town in North Carolina, I had to go to the ER because of a kidney infection, and I remember out of nowhere they did this thing where they placed a fist on my kidney and lightly punched it with their other hand, and the pain was so searing and awful that I just screamed and cried. They told me it was to make sure I wasn't faking it for the medication. Dude had severe and permanent back pain. He was prescribed Vicodin and he mysteriously ran out halfway through the month. Consistently. Obviously dude is taking extra, right? He's acting clueless and is beside himself when we tell him our suspicions. Through this entire time his wife is his biggest advocate. Even when he says, "I don't really need it, I'll survive," his wife is having none of it. She is his biggest support. Ultimately we decided to take away the Vicodin and his wife immediately thunders, "I need my duckling Vicodin, oh yours huh." She sold herself out. Not a medical professional, but when I was a teenager I had this friend who would literally fake seizures. At first we took it seriously because my other friends and I were young and didn't know better. She only did this when other people were around to watch and to sympathize with her. We would just stand there and watch. She wouldn't even shake. Yet she called them seizures. Eventually we smarted up and realized she wasn't even doing a good job of faking. Especially after she was taken to the hospital, so we tagged along because we were sleeping over Ross and we witnessed the doctor telling her parents that he doesn't know what's going on, but her body shows no signs of having a seizure. That person was ducking weird. Had a frequent flyer patient who did have some legitimate medical issues, but you could tell that there was more to it than that. Patient would tell us to push IV narcotics as fast as possible because it works better. Also had the usual "I'm allergic to every single week a painkiller but dilaudid" story. I suspected they were also fudging some admissions information. Was making the rounds at area facilities, but that's another story. Patient had to self-catheterize due to a bladder problem, but would regularly come in with raging urinary tract infections. While catheters can cause UTIs, the frequency and severity didn't seem to add up. On top of the other questionable aspects of this particular patient, turns out, patient was putting their fesses on the catheters before inserting them to cause the infection so they could come into the hospital for meds. Not a medical professional, but a co-worker of mine, let's just call her Linda, was involved in a minor car accident. Her car was able to be driven away. Went to the doctors and must have laid it on thick to try and get some sort of compo payment. Came back to work cause obviously the doctor wasn't having her bullet but played the victim for months on end, until I'm guessing her insurance compo failed to pay out, claiming that her spine was no longer connected. I called her on it too. Said, "Well Linda, you're doing okay for someone who should be at least paraplegic if your spine isn't connected." She just gave me a dirty look and said that's what the doctor said. My spine isn't connected anymore. And I just stand there looking at her like cute while the supervisor panders to her every need. Oh, don't worry, Linda. Everyone else can pick up extra work. Oh no, don't try to pick that up, just sit down. You just relax. When I wanted to be a physical therapist, I volunteered at one of my local clinics. We had a lady who claimed she was in excruciating pain. She couldn't walk more than 5 feet without literally screaming in pain in the clinic. She couldn't even move her toes without yelling profanities. She kept talking about how her meds ran out and needed more. She also started talking about how her whole family thought she was an addict, but she swore wasn't. I started feeling for her a little. She seemed nice and like she was going through some mess. But then once the doctor walked out of the room, her and I got to talking about music. I told her my uncle was in a bluegrass band and she mentioned how much she loved bluegrass. She loved it so much that the prior weekend, her and her husband spent 14 hours at a festival. She was tired, was carrying chairs around and dancing, and they were traveling to go to another one the day after her appointment. When I asked her if she had any pain during the festival, she said oh, none at all. It was a fantastic weekend, and then realized she gave herself up and got real quiet. When it turns out Op has Munchausen and was just looking for tips. Got called for a seizure to a park well known to be full of homeless drug addicts. We walk up and there is a man, laying in the grass in no distress. As soon as I say hi there he starts shaking his whole body and yells oh no, help me, I'm seizing, and his friend says I think you need to give him some Ativan for the seizures. Had a prisoner once that was faking full amnesia including name. I told him there was a nerve in his ear that if he put his finger in his ear and couldn't remember his name that he was for sure faking, because it even worked with severe dementia. Finger in ear, remembered name, finger out of ear, can't remember who he was, insta discharge back to jail. Not necessarily faking it, but I work at an clinic and definitely memorable when a patient asked if we would fill out an FMLA form for her period week every month. Like if you are actually so debilitated, which can happen, that is definitely something we need to address, and first step would be to get on birth control. Didn't want any sort of assessment or to start trying treatments. Just the form so she could get out of work every month. And surprisingly we denied that one. A bit late to the party, I had a patient who was supposedly comatose but was giving a few mixed signs when it came to making a definitive judgment. There is a test called a drop arm test, where you raise the patient's arm over their head and drop it. A non-comatose patient will move their arm on their own to avoid hitting themselves in the face. But I had a different idea. With the nurse in the room I said, okay, our defining test. If his arm stays straight up unassisted he is comatose. I let go of his arm and it stayed totally upright. The guy did himself in. I told him shortly after that the gig was up and he had no medical reason to be admitted. Oh gosh. I'm a paramedic and can't count the number of patients I've had that fake seizures, or fake being unconscious. It is absolutely sickening. A lot of times it's for family sympathy, but sometimes it's just for attention in general. It's insane. The one test I do that always gets the unconscious ones is the gurney drop. I sit behind them for a minute, long enough to let their guard down. Then I push the lever that drops the head of the gurney back so they go from sitting to laying in a split second. That moment when their upper body falls out from under them will always elicit the "oh it" response where they throw their arms up and open their eyes. Crazy. I actually just got out of the hospital and I'm reading this in bed. I should have gone to the hospital Monday when I had stabbing pain in my left side that doubled me over and made me puke, but I have an irrational fear that doctors are always going to think I'm faking and yell at me for wasting their time. So I psyched myself out and convinced myself that I was overreacting and the doctor would think I just want drugs or something, but I still felt like it today, so I forced myself to go. The doctor was very nice and it turns out I had passed a kidney stone on Monday. He sent me home with a note keeping me out of work for the next couple days and a small prescription for Vicodin. And told me from now on if you're in so much pain it's causing you to double over, just go to the damn hospital. Literally every day. Fake seizures, fake syncope, fake chest pain. The list goes on. Anything related to a fake seizure, That's the easiest thing to call it on and nobody will take you seriously. Getting pages that patients state they are in indescribable agony and screaming non-stop. Then going outside their room and listening a bit while they joke and laugh with their family only for them to start screaming again as soon as I walk in the room. Husband is a doctor waiting for his residency to start. Last year during a pediatrics clinical rotation he had several parents who has clearly coached their kids into faking all sorts of idiomatic aches and pains in order to get the doctors to prescribe opiates. I worked in an ER. And one day a guy came in by ambulance with his whole family. Supposedly he was having a seizure, flopping around and moaning. Doctor immediately says this isn't real. I don't know why he's doing this. Upon hearing that, he stopped flopping and moaning. He was silent for a second, then he opened his eyes and went, "My head hurts. Lol." Some details changed for privacy. I used to see kids faking it a lot to avoid going to school doing homework back when I was rotating in pediatrics. Best one was a 11-year-old who had read every symptom of appendicitis and regurgitated it as a medical student would in exams, and he didn't even have fever and his USG was normal. He could have won an Oscar for the acting though, including that small moan when examining the abdomen and checking for rebound tenderness. Well, not a doctor. But in school a friend decided he had enough of it for the day and go to the infirmary pretending he was blind. I was in the infirmary for a cut, so I watched the whole thing. At first he pretended he was blind from both eyes. After the nurse asked how he get to the infirmary alone, he changed to only the right eye. She goes to get a flashlight and when she asked again he said it was the left eye. Then she moved a finger in front of him, and both his eyes made the following movement. She placed a band-aid on his forehead, moved to treat my cut and said to him, "I fixed your mind's eye. You can go back to class now."